Hi, I'm Dr. Anna Day. Welcome to Pocket Compassion. Today we're going to do a compassionate meditation for pain management. So this combines somatic tracking, which is a technique used by Alan Gordon, and we're combining that with some compassion-focused therapy techniques. Okay, so if you just close your eyes, I'll close mine too. Just start with a nice deep breath through the nose. Sigh it out. And again. Sigh it out. Just keep that nice pattern of slow breath. Just getting into our soothing system. So notice the sensation of the floor beneath your feet. Apply a little bit of pressure if that helps. And just use that sensation as an anchor for your attention. So if your mind wanders, just notice it without judgment. That is what minds do. They love to wander. And then anchor your attention back on the sensation of the floor beneath your feet. Guide your attention up to where the chair supports your body and really sink into that support. And again, we're just going to use that sensation as an anchor for your attention. Nice compassionate posture with your shoulders relaxed and back, your chest open. Just bring a small smile to the face. And just sending the message from the body to the brain that we're safe. Now I'd like you to notice your pain. We're going to notice without judgment. We're not trying to change it. We're not trying to understand it. We're just approaching it with open curiosity. You can imagine that you're a spaceman floating in space, looking down on the planet that is your pain. Noticing the seasons coming and going. Any changes, just notice them. If it helps, you can imagine that your pain has a shape, or a colour, or a weight, or a texture. You're just noticing. Try describing your pain. You could use words like stabbing, or dull, or pulling, or pressure. Again, you're not trying to change it, you're not trying to understand it, you're just noticing it. Notice if it is changing at all. It's fine if it does, it's fine if it doesn't. Just let whatever happens happen. Remind yourself that you're safe. Notice again if your pain has changed at all. If the shape has changed, the texture, the colour, any of those words that you use to describe it, if they've changed. It's fine if it has, it's fine if it hasn't. We're not trying to change your pain, we're just trying to notice it. And just notice the emotions that arise alongside your pain. Pain can often lead to anxiety or grief or anger. Again, we're just noticing those emotions. We're not trying to change them. We're not trying to judge them. We're just noticing with open curiosity. And let's bring some compassion to this pain and any emotions that arise alongside the pain. You might want to place your hand on your heart, just a compassionate gesture. And start by validating the pain, validating the emotions. Tell yourself how hard it is to be in pain and to feel the difficult emotions that arise alongside it. Remind yourself of the universality of suffering. Often we can feel really isolated in our pain and our suffering. And just reminding ourselves that actually it's part of the human experience. And through our pain and through our suffering, we are united. Now we're just going to bring some kindness, some strength, some wisdom to our experience of the pain and those difficult emotions that go alongside it. Try offering yourself some words of support or advice. If you're struggling with this, imagine that you're saying them to a loved other, that you're talking to a dear friend or a family member. Imagine a healing, compassionate light springing up from beneath your palm, passing into your chest. And just notice how that feels to be on the receiving end of compassion. Notice if it changes your pain, if it changes those emotions. It's fine if it does, fine if it doesn't. We're just noticing. And then just some nice long blinks. Great, well done. I'll see you later.